Dr. Bebout here. Let's do our medical term of the day. Today, I want to talk about something that's just very, very common. Everybody's heard of, but I get a lot of questions about what does it actually mean? And that is your blood pressure. What is your blood pressure? Why is it important? Um, your blood pressure is the pressure that is measured inside the arterial system of your body. And it has two components, or two main components that the public should be aware of. Number one is the systolic pressure. That's the upper number. That is the pressure that is present in your arteries when the heart contracts and beats blood out into the arteries. So that's the higher number. The bottom number is the diastolic blood pressure. That is the pressure when the heart's at rest and just the natural everyday pressure that is in your arterial system. Both of them can cause significant problems. The normals, this is where it gets a little dicey. They put out normals, but then they're not really cut in stone normals. Just because you have an elevated blood pressure does not mean you have hypertension or high blood pressure. So let's talk about the stated normals and some other conditions. The normal put out by the American Heart Association is 120 over 80. Anything below that basically is normal, unless you go too low. So normal blood pressure, 120 over 80 or below. Low blood pressure is anything below 90 on the top number. If you have an elevated blood pressure consistently above 120 over 80, but not to the region we'll get to of hypertension, then that is called high blood pressure without a diagnosis of hypertension. Now, I never pay a whole lot of attention to anybody's blood pressure the first time they come into my office. Everybody's keyed up, they're anxious, they're nervous about this or that, they want to discuss something, and naturally your blood pressure is going to go up. I'd much prefer have a list of blood pressures taken at other facilities in here at different times before we commit you to taking blood pressure medicine. Now, where it starts to become hypertension, that is anything between 130 to 139 and 80 to 90 on a consistent basis. That's called stage 1 hypertension. Stage 2 hypertension is anything over 140 over 90. Then we get into some other labels of hypertension. These have various names, and some of them have probably fallen out of favor. Some of them are still used, but they're like accelerated hypertension, urgent hypertension, hypertensive crisis. These are all names given to when your blood pressure is above 180 over 120. The question often comes up, when do I need to go to the emergency room? Well, there's not a good answer to that. There's no magic number that says, oh my gosh, you got to go get emergent treatment. It becomes important if your blood pressure is elevated and you are having symptoms, stroke-like symptoms, TIA, numbness in the arm or leg, facial droop, chest pain, shortness of breath, passing out, things like that. Obviously, you need to go to the emergency room. So this is just a very, very brief rundown of what does blood pressure indicate and what do the terms mean. I can go into a lot more detail on each one of these, what we do about them, current treatments, dietary modifications, exercise modifications. There's all kinds of stuff. Hypertension, you can write books about it. So if you have any questions, you want to know anything in specific, you want to know about medications, you want to know about symptoms that certain diseases can cause related to hypertension, reach out to me and ask. Put it in the comments. Be sure to share this and like it so I can keep doing these. So have a good day.